The Committee on Homeland Security will come to order. The committee is meeting today to receive testimony on children in CBP custody, examining deaths, medical care procedures, and improper spending. Without objection, the chair is authorized to declare the committee in recess at any point. The committee is convening today to examine three critical, related, and deeply troubling issues: the terrible death of young children in the custody of Customs and Border Protection, CBP's failure to consistently implement the revised medical screening procedures it adopted after children died in its custody, and CBP's improper expenditure of emergency funds appropriated by Congress for the care of migrants. In December 2018, 2 children died in CBP custody: a 7-year-old girl named Jacqueline and an 8-year-old boy named Felipe. Last year, another 3 children died in CBP custody or shortly after being released. On January 4th, 2019, I sent a letter to the Department of Homeland Security requesting documents related to the deaths in 2018. After the department failed to produce all documents responsive to the committee's request, in November 2019, the committee issued a narrowly tailored subpoena by voice vote for many of the documents originally requested in my letter 10 months prior. In December 2019, the DHS Inspector General's office publicly issued 2 one-page summaries of its investigations into the death that had occurred a year earlier. Unfortunately, the Inspector General's investigations left us with more questions than answers. Earlier this year, I sent a letter to Inspector General Kafari detailing the concerns we identified with the report. My entire letter is available on the committee's website. Among the concerns I raised were the following: the Inspector General's report and public summaries proclaimed that there were no malfeasance or misconduct by DHS personnel. It is unclear why that standard was used, because there do not appear to have been any allegations of malfeasance or misconduct on the part of the agents. In fact, all available evidence indicates that Border Patrol agents showed great compassion for both children. However, the Inspector General's report appeared to presume that since its investigation found no malfeasance or misconduct, that's the end of the story. The report fails to examine the many troubling questions that these deaths raise regarding CBP's ability to care for children in custody, including questions about the adequacy of the agency's policies, procedures, and training. Further, while the Inspector General's office certainly conducted many interviews, it appears that key documents and evidence were not collected and reviewed. My letter also identified omissions in the public summary of one of the Inspector General's report that was so severe as to render the summary inaccurate and potentially misleading. The Inspector General revised the public summary after receiving my letter. Over the past 6 months, DHS has produced some documents in response to the committee's subpoena, but these productions are clearly incomplete. For example, Inspector General's report referenced documents that have never been provided to the committee. DHS has also made extensive and improper redactions in the documents it has produced. Though its refusal to comply fully with the committee's subpoena, and through its many redactions, the department is intentionally impeding the committee's investigation. Despite these hurdles, the committee has worked to advance our investigation. To help with that effort, we asked a pediatrician and a medical examiner to conduct independent examinations of the 2 deaths that occurred in December 2018. We will receive that testimony today. Today, the Government Accountability Office is also releasing a report we requested. It examines both CBP's use of emergency funding appropriated to care for migrants as well as the agency's implementation of new medical screening procedures it announced after the death in 2018. GAO's report found that after CBP claimed it urgently needed emergency funding to provide care for migrants taken into custody, the agency misspent money it received. The Border Patrol agents who cared for Felipe while he was in custody had to pay for medicine for him out of their own pockets. But CBP used some of the emergency funding that Congress appropriated for the specific purpose of paying for medical care to instead buy jet skis and dirt bikes and even dog food. There's something seriously wrong with this picture, just as there is something seriously wrong with the administration's approach to caring for migrants, including children. I note that GAO's report also finds that although CBP adopted new policies governing medical assessments for children following the tragic deaths of the two children in late 2018, CBP did not consistently implement these policies. We welcome Dr. Orna Danaher and Dr. Roger Mitchell before the committee, as well as Rebecca Gamler from GAO. And I'm glad that after initially refusing to do so, the Inspector General has agreed to testify before the committee so that we can explore the many questions regarding the work of the Inspector General's office. We also invited CBP's acting commissioner, Mark Morgan, to testify. In a letter to the committee, he stated that because of the White House baseless rules prohibiting administration witnesses from attending virtual hearings, he could not appear. As I close, let me say I fully recognize the sensitivities of the issues we are discussing. I encourage all members to be very careful and thoughtful in how we approach this subject. That said, it is clear that this administration will do everything it can to avoid oversight. Therefore, we must continue to do everything we can to hold this administration accountable. Given the 18 months of obstruction we have endured and have sought documents and information about the death of children in custody, as well as issues like the administration's child separation policy, I see no other way to advance our investigation and to identify changes needed in CBP's policies and procedures than to convene today's hearing. Before I recognize the ranking member, I'm going to read statements from the fathers of the two children who died in CBP custody in 2018. Mr. Cal Cruz, the father of Jacqueline, provided the following statement. I'd like to say what I have always believed. It is better to check on all children when they are sick, and even if they are not sick, to speak up and say something even if you are afraid. The most important thing is to check on the children, so the thing that happened to my daughter doesn't happen to anyone ever again. I offer my thanks to the committee for taking the time to look into my daughter's case, and I'm very grateful to you all. The father of Felipe, Mr. Gomez Perez, stated, I want justice. I want to know why my son didn't receive medical care in time. I don't want other children to go through the same thing. This is painful for me today, and I'll be painful for the rest of my life. Every night I ask myself why my son didn't receive medical attention in time. Felipe's treatment was inhumane. I ask unanimous consent to submit their letters into the record. Without objections, so admitted. The chair now recognizes the ranking member of the full committee, the gentleman from Alabama, Mr. Rogers, for an opening statement.
Thank you, Mr. Chairman. Can you hear me?
Yes.
Great. I appreciate you holding this hearing, and thank you again for granting our request to use the committee room. I am too saddened by the loss of Felipe and Jakelin. Both children and a teenager died while in the custody of CBP or shortly after entering custody, which is totally unacceptable. The department has taken measurable steps to improve migrant care, but it's up to us in Congress to address the root cause of the problem. That can only happen in a bipartisan manner. It means that we must fix immigration loopholes. We must provide real and adequate resources to both CBP and ICE. We must not encourage illegal immigration to our border. We must disrupt the cartels and their human smuggling partners. And I hope we will never have to hear of another tragedy at the borders like what happened with these 3 minors. Mr. Chairman, I'm disappointed at some of the events leading up to this hearing. Acting Commissioner Morgan should be here so this committee can directly hear from him. It's important that we understand what happened and what CBP has done since those 2 deaths. The majority did invite Acting Commissioner Morgan, but they also knew he couldn't participate in a remote hearing. OMB has provided guidance to senior administration officials forbidding them from participating in remote hearings. They are permitted to appear in person. Acting Commissioner Morgan did before the Senate committee on June 25th. I ask unanimous consent to insert into the record Acting Commissioner Morgan's response to the chairman's invitation. In that letter, Morgan requests to appear before the committee in person in accordance with OMB guidance. If we want productive hearings, I would suggest to the majority that we find time to hear from him in the next 2 weeks when we are in D.C. Further, getting to the bottom of those 2 deaths is something that this committee has worked together on. We voted unanimously last November to subpoena the department on information related to the deaths of Felipe and Jakelin. However, following the subpoena, it appears the majority requested and received additional information from the University of Mexico Office of Medical Investigations. It appears the majority then shared this information with witnesses here today and who knows who else before informing the minority of its existence. One witness claims to have received the information on June 30th. The minority got it on July 12th. It's very disappointing to partner with you on things like this, to have them turn out to be partisan and less than a week before the hearing. I'm also alarmed by the autopsy information the majority requested. I don't see any legitimate reason why this committee or any committee of Congress would need human tissue samples from a deceased 8-year-old boy. I'm concerned the majority's motive in requesting and then sharing with their witnesses these autopsy specimens is to try and place blame for those deaths on the men and women of Border Patrol. If that's true, it's deplorable. The IG found that there was no misconduct or malfeasance in any of the actions of DHS or its employees surrounding these unfortunate deaths. I understand that answer. It doesn't provide any political satisfaction, but those are the facts. If the majority requested and then shared human tissue samples of a deceased child just to advance a political narrative, it would mark an appalling new low for this committee, and I hope that's not the case. We must remember that for months, Congress refused to address the border crisis that precipitated these deaths. Record numbers of families and children crossed our border last year. Groups of hundreds to thousands of migrants came across it at once. Migrants traveled over 2,000 miles at the whims of the cartels and human smugglers to get to our border. Many told of abuse, assaults, and worse on the journey to our border. Food, nutrition, access to medicine was not adequate, if at all provided. As a result, many, like Jakelin, arrived in extremely poor health. At the height of the crisis, Border Patrol agents spent over half their time transporting migrants to hospitals. But for months last year, the majority refused to even acknowledge the problem, going as far as to call it a manufactured crisis. Even after the children died, the majority insisted there was no crisis at our border. At one point last year, the majority's response to the border crisis was to send 316 tweets, 11 press releases, and hold 6 hearings. None of that solved anything. Finally, after months of denying it, the majority finally admitted there was a crisis. A supplemental appropriations bill was brought forward to the House, yet that bill had so many poison pills attached to it, the Senate had to strip them out before it could head to the border. Unfortunately, that bill was at best a stopgap measure. The Homeland Security Advisory Committee recently concluded that until Congress takes action to address the root cause of last year's crisis, it's only a matter of time before another one occurs. I hope at some point we can get off the political messaging game and work together to fix the immigration loopholes that encourage parents to send their children on a dangerous and oftentimes deadly trek to our border. Thank you, Mr. Chairman. I yield back.
Thank you very much, Mr. Ranking Member. Other members of the committee are reminded that under committee rules, opening statements may be submitted for the record. Members are also reminded that the committee will operate according to the guidelines laid out by myself and the ranking member in our July 8th colloquy. I now welcome our panel of witnesses. Our first witness is Dr. Farna, I hope I get it right, Danaher, a pediatrician at Massachusetts General Hospital, Chelsea Health Care Center, and a member of the hospital's child protection team. She's also an instructor in pediatrics at Harvard Medical School. Dr. Danaher is a graduate of Mount Sinai School of Medicine. Our second witness is Dr. Roger A. Mitchell, Jr., the Chief Medical Examiner for Washington, D.C. Dr. Mitchell, Jr. is board certified in anatomic and forensic pathology by the American Board of Pathology and a fellow in the National Association of Medical Examiners. He began the study of forensic science as a forensic biologist for the Federal Bureau of Investigation in 1997. Dr. Mitchell is a graduate of the New Jersey Medical School. Our third witness is the Honorable Joseph V. Kafari. He was confirmed as the Department of Homeland Security's Inspector General on July 25th, 2019. Dr. Kafari previously served as a policy advisor for military and veteran affairs for the governors of Arizona. He also served more than 40 years in the United States Air Force. Dr. Kafari earned a PhD in management in 2002. Our final witness is Ms. Rebecca Gamler, a director in the Governmental Accountability Office, Homeland Security and Justice team. Ms. Gamler joined GAO in 2002 and currently leads the agency's work on border security, immigration, and election issues. Without objections, the witness's full statement will be inserted in the record. I now ask each witness to summarize his or her statement for 5 minutes, beginning with Dr. Danaher.
Good morning. Chairman Thompson, Ranking Member Rogers, and members of the committee, thank you for the opportunity to testify before you today. I'm Dr. Fiona Danaher, a pediatrician at Massachusetts General Hospital for Children, where much of my clinical work focuses on the care of children and immigrant families. It is a privilege to participate in this committee's efforts to improve the care of children in U.S. Customs and Border Protection custody. As you know, in December of 2018, 2 children in poverty in their rural Guatemalan villages became the first migrant children without underlying medical conditions to die in U.S. custody in a decade. Jacqueline Collin McKean, age 7, died from septic shock, which, because it went untreated over many hours, cascaded into multiple organ failure. Felipe Gomez Alonso, age 8, died from untreated influenza, complicated by pulmonary hemorrhage in the context of bacterial pneumonia and sepsis. Their deaths, as well as those of 4 other children in government custody between September 2018 and May 2019, underscore the deficiencies in an immigration system poorly designed to protect the well-being of vulnerable children. Review of available records makes clear that Jacqueline and Felipe both suffered terrifying and painful deaths that could potentially have been prevented by timely access to pediatric medical care. In both cases, medical examiners determined the children had died of natural causes, and the OIG concluded there was no misconduct or malfeasance by DHS personnel. However, death by natural causes does not mean that death was inevitable, and lack of misconduct or malfeasance, or even the great effort several agents went to in assisting the children, does not absolve CBP as an agency of perpetuating systems that place children at risk for medical neglect. CBP responded to Jacqueline and Felipe's deaths by issuing an interim enhanced medical efforts directive in January 2019 to ensure that all children under the age of 18 received health interviews and medical screenings while in CBP custody. However, the final Enhanced Medical Support Efforts Directive issued by CBP in December 2019 removed many of the safeguards instituted under the interim guidance, weakening it so much that had it been in place at the time of Jacqueline and Felipe's presentations, it is unlikely its provisions would have prevented their deaths. Children are not little adults. Their remarkable physiological resilience can mask severe disease from those untrained to recognize it. Any period of detention is inherently unhealthy for children's long-term physical and emotional development. But detention in substandard conditions places children's very lives at risk. If children are to be detained in CBP facilities, it is incumbent upon the agency to strengthen its medical infrastructure. Jacqueline and Felipe's deaths illustrate the need for CBP to eliminate bureaucratic hurdles that unnecessarily prolong detention and delay access to medical care. They also highlight the urgency of addressing detention conditions that promote illness and its spread. Children in detention need timely access to comprehensive medical screenings in their native language, conducted by clinicians with pediatric expertise, followed by referral as appropriate to pediatric medical centers. Those diagnosed with illnesses or underlying medical conditions should not be returned to detention facilities, which are fundamentally unequipped to provide safe observation or promote children's recuperation. Teams of agents working in remote areas must include EMTs with enhanced pediatric training, and all forward operating bases and Border Patrol stations should be stocked with basic pediatric medical equipment and with staff trained in its use. CBP must implement the Centers for Disease Control and Prevention's recommendations for the prevention of influenza and COVID-19 in its facilities. Independent oversight of the quality of medical care provided to detainees needs to occur regularly, as the OIG indicated in its own capping report that it does not possess the necessary medical expertise for the task. Given the current COVID-19 epidemic and the impending arrival of another influenza season, time is of the essence. Action must be taken now to apply the lessons learned from Jacqueline and Felipe's tragic deaths, so that other children do not meet similarly painful and preventable fates while in custody of the United States government. Thank you, and I look forward to taking your questions.
Thank you very much for your testimony. I now recognize Dr. Mitchell to summarize his statement for 5 minutes.
Good afternoon, Chairman Thompson and Ranking Member Rogers and members of the Committee on Homeland Security. I'm Dr. Roger Mitchell, Jr., and I currently serve as the Chief Medical Examiner of Washington, D.C. It brings me no pleasure to testify today on these deaths in custody, but I appreciate the confidence of the committee in asking me to do so. I've been asked to review the cases of Jacqueline Call McQuinn and Felipe Gomez Alonso from the medical examiner's perspective, specifically postmortem findings, the autopsy report, cause, and manner of death. I've been studying deaths in custody for over 20 years, and although when we think about deaths in custody, we're reminded of deaths like George Floyd and Rayshard Brooks, deaths in custody occur under a continuum that moves through phases like arrest-related, pre-arrest-related, and more importantly for this case, in custody and incarceration, which is short-term and long-term jail detention. In addition, I've served as the chair of the Child and Infant Fatality Review Committee for DC from 2014 to 2019. This committee had been tasked to review infant and child deaths for the purposes of creating system-centered recommendations intended to improve outcomes. This is the lens in which I review these following cases. We know that Jacqueline Call McQuinn was a 7-year-old female child who was apprehended with her father on the US border and was found to have a temperature of 105 and then subsequently airlifted to a hospital where she was pronounced dead over 24 hours later. Jacqueline suffered from septic complications from a bacterial infection. The initial laboratory and autopsy findings are consistent with bacterial sepsis. It's important to note that sepsis can progress to organ failure and shock rapidly. Therefore, early recognition and treatment are critical. So based upon the materials I had to review, and it's my opinion that the cause and manner of death established by those medical examiners is sufficient. It's also my opinion that this death was preventable. Although the actions taken by individual Border Patrol agents seem to be appropriate and timely, the larger Border Patrol system lacks adequate human resources and physical infrastructure to respond to medically fragile detainees, especially children. The administration of the initial health assessment questionnaire had been performed by a licensed medical professional. The elevated body temperature would have been detected and maybe have saved a life. The next case, Felipe Gomez Alonso, we know is an 8-year-old male child who was apprehended with his father at the U.S. border. They were detained at 3 different Border Patrol stations before he was known to be sick and was found to have a temperature of 103. Now, he was transported to a local hospital, diagnosed with an upper respiratory infection, prescribed medication, and released, but then had to come back because of a worsening condition and was pronounced shortly after. Felipe suffered complications of a flu viral infection associated with a superimposed bacterial disease, a bacterial infection again. This bacteria isolated were associated with an aggressive exotoxin and a very highly contagious bacteria that is particularly contagious in close quarters and conditions of overcrowding. This exotoxin leads to severe, rapidly progressing hemorrhagic pneumonia or necrotizing pneumonia. Based upon the review of the materials available, it's my opinion that there should have been highlighting of this necrotizing pneumonia in the diagnosis, but nonetheless a bacterial infection that led to the death of this young child. The manner of death is natural. It is my opinion that this death also is preventable. Overcrowding is a known condition of the Border Patrol stations, and I believe that the overcrowding conditions may have played a significant role in the infections that led to Felipe's death. There are many missed opportunities to provide life-saving care to this child, namely the hospital's mismanagement of this initial presentation. However, again, if there was a licensed medical professional who would have cared for this patient while at the Border Patrol station during this initial assessment, then there may have been a more informed assessment prior to his initial presentation at the hospital and may have led to better outcomes. So what are my recommendations? Well, enforce and control the population of the U.S. Border Patrol station to protect against overcrowding. Utilize medical personnel for the initial health assessment of detainees, especially children. Accompany this initial assessment with a brief health screening assessment like touchless temperature checks and blood pressure, glucose finger sticks, or even a COVID nasal swab in this environment. And develop an on-site clinical system for the U.S. Border Patrol that has the ability to triage pediatric patients. Maybe even an electronic health record, seeing that these patients move from Border Patrol station to Border Patrol station, and then retraining of our agents. In conclusion, immediate and timely access to healthcare assessment by a licensed trained medical professional could have prevented the deaths of both Jacqueline and Felipe. The deaths of both these 2 children are symptoms of a more extensive system that requires much improvement. No system is perfect, but any system that is established by our government must have at its core the health and safety of all who come into contact with it. The cases of these 2 children must remind us that deaths in custody are not merely a criminal justice issue, but a public health one. We must provide timely, accurate, and reliable care, not only in the detention centers of our borders, but also the streets of our cities, the jails of our counties, and the prisons of our states. I appreciate the work that this committee is doing to solve this problem. I pray that this hearing does not only provide an appearance of addressing the issue that I've outlined, but a true call to action with resolutions. This may require your dedication to this nation beyond what is comfortable for some, but I believe it's attainable. Thank you, Chairman Thompson and members of the committee. I'm now available for any questions that you may have.
Thank you, Doctor, for your testimony. I now recognize Inspector General Kafari to summarize his statement for 5 minutes.
Good afternoon, Chairman Thompson, Ranking Member Rogers, and members of the committee. Thank you for inviting me to discuss our work related to children in CBP custody. My testimony today will include a discussion of our investigations of the death of the 2 migrant children while in CBP custody, the findings of our unannounced inspections of CBP facilities, and an overview of our data-driven risk-based audits, inspections, and investigations. No parent should have to go through the devastation of losing a child, and my deepest condolences go out to the families who suffered this terrible loss. I'm a parent and a new grandparent myself, and I find the deaths of both children heartbreaking. Although they died within 80 days of each other and less than 100 miles apart, each circumstance was unique, and our office conducted separate investigations. The scope of both investigations was to determine the circumstances of the in-custody deaths of the children, including any form of misconduct by CBP personnel. We dedicated several special agents to each investigation, along with multiple support staff, and we were augmented by CBP OPR in one case. In total, we conducted 44 interviews between the two investigations, reviewed voluminous medical records and reports. Neither investigation found misconduct or malfeasance on the part of CBP personnel. In fact, both investigations determined that the CBP employees involved exhibited great concern for the children's welfare and obtained medical treatment without delay. During fiscal year 19, CBP experienced a surge in families and unaccompanied children crossing the southwest border and apprehended more than twice the undocumented aliens during FY19 than in any other previous 4 full fiscal years. Our office has for many years conducted unannounced inspections of CBP facilities to evaluate their compliance with CBP's transport, escort, detention, and search standards, known as the TED standards. During our unannounced visits, we focused our elements of the TED standards that can be observed and evaluated by our inspectors without specialized law enforcement or medical training. We recently issued a capping report summarizing our 2019 unannounced inspections. Our inspections found medical coverage varied by facility. The facilities we did visit generally met the TED standards for access to medical care. Nevertheless, crowded conditions presented health challenges, including containing the spread of contagious diseases. Given these observations, we have initiated an audit of CBP policies and procedures for handling medical intervention in detention. With the surge in apprehension in 2019, we observed more and severe overcrowding and recommended that DHS take immediate steps to alleviate it. Our capping report supplemented that recommendation and made 2 additional recommendations related to telephone access to unaccompanied children and proper handling of detainee property. DHS is on track to implement these recommendations by the end of this calendar year. Given our observations of detainees being held beyond the 72 hours generally permitted in the TED standards, we also initiated a review, which is ongoing, to identify the key factors contributing to prolonged CBP detention. We have for more than 20 other ongoing or planned projects reviewing ICE and CBP. We appreciate the committee's continued interest in our work and for Congress's robust funding this current fiscal year. With your increased funding, we are contracting for medical professionals to supplement our expertise across audits, inspections, and investigations. And I'm pleased to report this contract will be awarded in the next few weeks. In October of 2019, I personally observed the conditions at the southwest border when I visited DHS facilities and operations in both El Paso and the Tucson areas. Our office continues to monitor the situation at the border and recommend improvements to DHS programs and operations. Mr. Chairman, this concludes my testimony. Thank you for the opportunity to discuss our important work here today, and I'm happy to answer your or the members' questions that you may have. Thank you.
Thank you very much for your testimony. I now recognize our next witness for 5 minutes.
Good afternoon. Good afternoon, Chairman Thompson, Ranking Member Rogers, and members of the committee. I appreciate the opportunity to participate in today's hearing to discuss GAO's work on CBP efforts to provide medical care to those in its custody along the southwest border. My remarks are based on a report GAO is releasing today and a legal decision we issued last month addressing issues related to CBP's use of funds for and efforts to provide medical care. I will be covering 3 areas from the report and legal decision. First, CBP's use and oversights of funds it received for consumables and medical care under the fiscal year 2019 emergency supplemental appropriations. Second, CBP's efforts to enhance medical care. And third, CBP's reporting of deaths in its custody. First, last summer, the fiscal year 2019 Emergency Supplemental Appropriations Act was enacted to provide for humanitarian assistance and security at the southwest border. The act required that CBP use certain funds for specific purposes, which are referred to as line items. One of the line items in the act was consumables and medical care. We found that CBP obligated some funds in the line item for consumable and medical care goods and services like food and hygiene products, masks, and gloves. However, CBP also obligated some of the funds for other purposes like goods and services for its canine program, equipment for facility operations like printers and speakers, and facility upgrades and services. We found that these obligations violated an appropriation law known as the Purpose Statute because CBP obligated funds from the consumables and medical care line item for some goods and services that were not consistent with the purpose of that appropriation. We concluded that CBP should adjust its accounts accordingly. We identified 2 factors that contributed to CBP's violations. 1, insufficient guidance to CBP offices and components before obligations were made, and a lack of oversight roles and responsibilities for reviewing obligations once made. We recommended that CBP develop and implement additional guidance and establish oversight roles and responsibilities to ensure supplemental funds are obligated consistent with their purposes. CBP concurred with these recommendations. Second, CBP has taken various steps to enhance medical care and services for individuals in its custody. These steps include increasing its use of contracted medical care providers, issuing new health screening policies, and requesting the CDC assess conditions and make recommendations for the reduction of influenza in CBP facilities, among other things. As a more specific example of CBP's efforts, in 2019, CBP issued interim and updated medical care directives, which, among other things, required health interviews and medical assessments for certain groups. In March 2020, CBP issued implementation plans for these directives. While these are positive steps, we found that CBP has not consistently implemented its enhanced medical care policies and procedures. For example, we found that some CBP locations were not consistently conducting health interviews and medical assessments as required by the medical directives. CBP also has not documented how it made its decision not to offer influenza vaccines to those in its custody as recommended by the CDC. We recommended that CBP develop and implement oversight mechanisms and document what information it is using to assess whether to offer the influenza vaccine to individuals in custody. CBP concurred with these recommendations. Finally, CBP is supposed to report information on deaths of individuals in its custody to Congress. We've reviewed CBP's documents and reports from fiscal years 2014 through 2019 and found that 31 individuals died in custody along the southwest border during that period. However, CBP only documented 20 deaths in its congressional reports. We recommended that CBP ensure reliable information on deaths in custody is reported to Congress and appropriate documentation on such reporting is maintained. CBP concurred with this recommendation. In closing, while CBP has taken steps to enhance its medical care efforts, our work has identified a number of areas requiring additional attention to ensure that CBP is appropriately using supplemental funds it receives, overseeing medical care efforts, and reliably reporting information on deaths in custody to Congress. Going forward, we will be monitoring CBP's actions to address our recommendations. This concludes my prepared statement, and I'm pleased to answer any questions members may have.
Thank you for your testimony. Now, I thank all the witnesses for their testimony. I remind each member that he or she will have 5 minutes to question the panel. I'll now recognize myself for questions. To Mr. Kafari, as you know, we sent a letter to you asking for a number of things, the committee, and you sent it back. We reviewed it, and after we sent our response back, you revised the public summary. Why did the original public summary include any reference to influenza as a cause of death?
Mr. Chairman, you're correct. In the interest of privacy, initially, we included a high-level summary of information on our public website regarding the deaths of the two children. Subsequently, at your request, we made an adjustment to that public summary to include a diagnosis of influenza B and to indicate that our investigation did not reveal Border Patrol were aware of that diagnosis. I'd like to add that this is the very first time that we have done public summaries in this fashion, and we wanted to make sure that we got it right the first time, and we thought it was appropriate to basically err on the side of privacy for the children. But out of deference to you, sir, we've added those and made those minor corrections.
Well, thank you. So have you noted on your website or the summary itself that the summary has been revised?
Yes, sir. We did that the same day we made the updates and sent those to your staff.
Thank you very much. With respect to your review of the initial death, did you have qualified medical professionals on your review team?
No, sir. Just to clarify for the committee's consideration, those two reviews were actually investigations conducted by our Office of Investigation of the two deaths of the children in custody. We didn't have at the time any medical professionals available for our staff, but as I indicated in my opening statement, based on the enhanced funding that you provided this past fiscal year, we are contracting out to have a team of healthcare professionals augment any of our ongoing or projected work in the future, audits, inspections, and investigations.
So at the time of, based on what you've just said, at the time of your review of the deaths, you did not have on staff or contracted any medical personnel?
No, sir.
Dr. Mitchell, you've heard my question. In your professional opinion, do you think if you're looking at a death of any kind, that a medical personnel would be important to the team?
Yeah, absolutely. I think that especially deaths in custody require fatality reviews. Most fatality review panels need to be multidisciplinary, and that therefore you're going to get the recommendations. So it's going to really depend upon what you're trying to get out of the investigation. But from a fatality review construct, you need to not only have clinicians like pediatricians if it's a child death, internists if it's an adult death, but also a forensic pathologist or medical examiner so they can be able to interpret the findings at autopsy. So all of that is going to be required in the future if it's going to be helpful.
Thank you very much. Mr. Kafari, according to your report, Border Patrol agents stated they were in contact via text message with Felipe when Felipe was transported to the hospital the first time, the morning of December 24th. Do you have copies of any of those text messages in your file?
To my knowledge, sir, no, we do not.
So you put in a report information that you could not document?
We documented, sir, the testimony from the Border Patrol agents and their supervisors, all credible testimony.
I understand that, but nobody thought to get a copy of the text messages or anything like that?
Not to my knowledge.
Well, did the Inspector General's office pull or review any emails or other electronic messages involving CBP personnel regarding Felipe's care or death?
Not to my knowledge, sir.
Thank you. I now recognize the ranking member of the full committee for questions.
Thank you, Mr. Chairman. I think it would be more productive if I yield my time to our colleague from Tennessee, Dr. Mark Green.
Chairman,
The gentleman from Tennessee is recognized for 5 minutes.
Chairman, ranking member, and witnesses, thank you. The hardest part about being a doctor is sometimes you do everything you can for a patient and they still die. Mr. Chairman, I'd like to introduce myself. There's a few things I've never shared, but today it's important I do so. I graduated in the top third of my med school class, attended the #1 emergency medicine residency training program in the nation. All 3 years in residency, we scored #1 in the nation, and yes, we beat those Harvard doctors too. I deployed all over the world in some of the most remote places on the planet, provided medical care to children of Afghani villagers and battle-hardened Navy SEALs and Delta operators. I've never been sued for malpractice. I served as the medical director of 4 different emergency departments in 3 states, ranging from depressed rural to a level 2 trauma center. I was CEO of a company of emergency physicians and PAs and nurse practitioners that ran 52 emergency departments in 11 states. I've served as both defense and plaintiff expert on tons of med mal cases doing exactly this, forensically assessing care given. In this case, first by CBP and then medical facilities. Both of these cases are about pediatric sepsis. First, a few facts about ped sepsis. A review of the medical literature on sepsis recounted 4 studies in the United States that found that even when a patient goes to a state-of-the-art emergency department, the mortality rate for sepsis in America was 10.3% in one, 8.9% in another, 14.4%, and 19% respectively. Even when these patients present to EDs in the U.S., many still die. Why is this disease process so hard to treat? Well, like Dr. Danaher said in her testimony, children don't look bad until the very end. When I trained EM residents, we called it the pediatric cliff. They look great and then crash in seconds. I appreciate the written testimony of our pathologist who honestly reported that in both cases he felt, and I quote, "the actions taken by individual U.S. CBP agents seem to be appropriate and timely," end quote. I infer from this that Dr. Mitchell understands that standard of care depends on where you are and the facilities available. Dr. Danaher's testimony is disconnected from this idea. The reality of rural healthcare is millions of Americans aren't able to walk into a Harvard quality care. The standard of care at Mass General on a given day will never be comparable to triaging 160 migrants in the dark of the night in Antelope Wells. Dr. Mitchell's testimony is balanced and professional. It's not political hyperbole, but it does suggest that the federal government has the ability to deploy doctors to remote areas of the border to interview migrants about their health and do a variety of tests, which is simply unrealistic. Dr. Danaher's written testimony is blatantly partisan. She critiques the conditions of CBP facilities going on about lack of toothbrushes and clean water. I know from my own visits to CBP facilities and the facts in these cases, those allegations are simply false. She also discusses the psychological dynamic of the dad of one patient to not share information to agents as if that environment is the law enforcement officer's fault. That dynamic existed because he crossed the border illegally and then didn't tell agents that Jakelin was sick, even when they repeatedly asked him. If a patient presents to an ED in the United States and lies about their medical condition, it's not the doctor's fault. Look, both of your testimonies center around getting more resources. The bottom line, you want more doctors and electronic medical records. Just published yesterday, new estimates of doctor shortages in the U.S. The U.S. is short 14,494 doctors. Where in the world are we going to get doctors to put somebody at every single crossing site? This testimony proposes building healthcare infrastructure for illegal immigrants that would dwarf the healthcare systems in 77% of rural counties in America. Last year, House Democrats voted to advance an electronic medical record to illegal immigrants within 90 days when veterans in many states still don't have it and won't have it for 7 years. Finally, this side of the aisle spent all of last year highlighting how dangerous the journey to our border is for kids. The answer is not to turn CBP stations into Mass General. We have to break the cartels that entice people to come here with children and fix our immigration law loopholes. Until we do that, smugglers will continue to turn a profit over enticing families to come to our border with false promises. Mr. Chairman, I yield.
Thank you very much. The chair now recognizes other members for questions they may wish to ask witnesses. As previously outlined, I will recognize members in the order of seniority, alternating between majority and minority. Members are reminded to unmute themselves when recognized for questioning, and to the extent practicable, to leave their cameras on so they are visible to the chair. The chair now recognizes for 5 minutes the gentlelady from Texas, Ms. Jackson Lee.
Mr. Chairman, thank you for holding this very important hearing, and thank you to the members of the witnesses who are here as well, who have provided very important testimony. All of us were shocked to learn in December 2018 that 2 children died in separate incidents while in the custody of the U.S. Border Patrol, which were the first deaths of children in Border Patrol custody in more than a decade. I want to be very clear that when you lead a nation, all that happens, whether you like it or not, falls at your feet. I've known Border Patrol agents and visited with them in my state of Texas for decades. I've seen their passion. I've seen them buy baby food and formula. Where this tragedy falls is clearly at the feet of an administration that is inattentive and does not recognize that we are to comply with the international protocols of human rights and human decency. Following the deaths of those 2 children in 2018, U.S. Customs and Border Protection, the Border Patrol parent agency, issued an interim directive in January 2019 establishing new medical screening and other procedures. I physically went down to the border and saw the immediate emergency tactics that were used. It was a table and the use of Coast Guard doctors. They all meant well. Dr. Daniger, thank you for your leadership. My question, as all of this falls at the feet of the President of the United States and the administration, and we have to adhere to human rights protocols, can you please elaborate on the differences between pediatric disease processes and adult disease processes, so that when you know that a child may be sick, and why understanding the nuances of each is important, especially in these situations? Dr. Daniger?
Certainly. So children are physiologically different from adults. They can compensate in different ways for infection than adults can. And as Dr. Gray mentioned, when they are sick, they can look well for quite a while before they crash. That is all very true. So I think it's really, really important for there to be pediatric expertise at the border. And that does not necessarily have to mean pediatricians. It means enhanced training for the EMTs who are already working with the Border Patrol. Currently, EMTs in New Mexico, where both of these children were apprehended, only get about 10% of their training dedicated to pediatrics, which only amounts to a few hours. So it's incredibly important to be able to recognize when children get sick. They definitely look different.
And you understand that Border Patrol agents are not doctors, they're not EMTs, not nurses, correct?
Correct.
And so it would be your view that minimally a nation as powerful, as rich as the United States could recognize the importance of those nuances and have a system in place that would deal with pediatric issues or children who are in life and death situations. I didn't hear you, I'm sorry.
Yes, yes.
Thank you. To the Inspector General, Mr. Kafari, you did a report. There was some suggestion that CBP officers tried to engage with the parent. Do you know what language they spoke to Jacqueline's father?
I believe, ma'am, Jacqueline's father indicated on his in-processing paperwork that he was fluent in the Spanish language, and the Border Patrol agents would have spoke to him in Spanish.
My understanding is that he spoke his indigenous language, Craieki. Did anyone try to speak to him in that language to make sure he understood?
Not to my knowledge, ma'am.
So what elements of change would you recommend, or did you recommend, in light of the 2 deaths of children that had never happened, and it certainly didn't happen with the mass migration during the Obama administration.
We actually, as I mentioned in my opening statement, we have 3 ongoing projects to look at the matters that you just asked about. These are 3 of 21 that I had in my prepared statement. And we will make recommendations based on what our findings are at the time, and then hold DHS accountable for implementing those recommendations.
And the recommendations that you are looking to is framed around 2 deaths and as well no response timely enough to save those lives.
We're looking at the circumstances that surrounded the deaths, the medical care, and the access that's capability of being provided by DHS to the children who are in custody, as well as to others, adults, et cetera.
Well, let me just say that we have 3 million plus COVID-19 deaths in the United States. Obviously, there will be major investigations dealing with the responsibility of this administration in 3 million cases. Let me correct myself. 3 million plus cases rising to 140,000 deaths, maybe about 137,000 deaths. Make sure the record is clear. 3 million plus cases. Many of those cases are obviously in states like Texas, New Mexico, and even Mississippi and others. And so I would emphasize that your work is extremely important. When the federal government fails the nation, it is important for there to be concise, direct, widespread understanding of why and directions as to how that is remedied. The loss of a child is precious. I give my deepest sympathy to the families, and therefore we must make sure that we correct it. I thank you, Mr. Chairman, and I yield back.
Thank you very much. Chair now recognizes the gentleman from New York, Mr. Katko, for 5 minutes.
Thank you, Mr. Chair. And having lived on the border and prosecuted cases on the border in the mid-90s, I can tell you back then that the border and the porousness of the border was a problem, and it attracted more and more people. And tragedy often resulted back then, and it's still happening today, and it's a terrible thing. It's a terrible thing to ever lose anyone at the border in custody. It's a terrible thing ever to lose them with if they're a child. And we have to do all we can to make sure that that's going forward. But I will note that it's an incredibly complex issue, much more complex than I think some of the dialogue today. And for that, I'd like to defer to my colleague, Dr. Green, to take the my time. I yield to him.
Hi, this is the House Democratic Caucus. We were calling to connect you to our live conference call, but it appears
The chair recognizes the gentleman from Tennessee for the balance of the time.
Thank you, Mr. Chairman.
Thank you, Mr. Chairman. Dr. Mitchell, you mentioned in your testimony that resource hurdles, prolonged CBP custody, and delay access to medical care. I agree. The efforts led by House Democrats to defund ICE have had sweeping consequences, mainly impacting CBP facilities, such as what happened during December of 2018. ICE family residential centers were at capacity, forcing CBP to hold immigrants much longer than they should. The bureaucracy exasperated by the border crisis, preventing those CBP custody from reaching ICE facilities built for long-term holding and for more through medical assessments and access to care. My question to you is, do you support additional funding for ICE capacity and medical staff to ensure that children don't get stuck in CBP custody like they did last year?
Yeah, I think that any funding that's going to go forward to resolve this issue must go forward to decrease any overcrowding burden. I'll leave it up to the House and the politicians to understand where exactly that goes and what the agencies use, what agencies get those resources. But I think you and I agree, Dr. Green, that overcrowding conditions is a major concern, particularly when we're talking about infectious disease. And then as far as the issue of timeliness, and I appreciate you elucidating the fact that I wanted a better access to healthcare there at the border. I agree. I think physicians would be a hard burden, a hard bar to reach. But I believe that there's opportunities, as my colleague Danaher described is that higher training of the EMT, maybe nurses, nurse practitioners that are available there to make sure that the burden is not placed on our agents to try to triage these patients.
I really appreciate your comments, and I think clearly we on our side of the aisle would like to see more funding for ICE. There are a lot of people, especially for those detention facilities, a lot of people on the other side of the aisle want to defund ICE. But I want to follow up one more question, Dr. Mitchell, for you before my time expires. You indicated in your testimony that you believe Jakelin's death could have been prevented in the initial health assessment questionnaire if it had been performed by a licensed medical provider. You may not know this, but yesterday, DHS, or not DHS, but HHS released the doc shortage. 77% of America's rural counties right now are short both doctors and PAs, and by 2032, that's going to be 121,000 short. Where do we get these medical providers? I mean, would we take them from American cities? I'm eager to hear your thoughts on that.
No, and again, I think the shortage of medical providers is across the nation, as you described. I just don't believe that the recommendation that of providing adequate health screening to whoever we come into contact with, it stops being a recommendation because the hurdles and barriers are too big. I think our job is to try to create opportunities where we can meet the goal of saving lives wherever it exists. And so, no, not take it away from anyone, but attempt to provide it to everyone.
Yeah, we just have to be realistic in our solutions and find solutions that work. And your recommendations were, a licensed medical person. And with the shortage we already have, I just don't see how that can happen. I think my time has expired, Mr. Chairman.
Thank you. The chair recognizes the gentleman from Louisiana, Mr. Richmond, for 5 minutes.
Thank you, Mr. Chairman. And as much as I would want to go into the shortage issue and the proverbial Trumpism of pitting communities against each other, and I guess that's what we're doing in terms of access to doctors, I just won't entertain it. I mean, we are the greatest country in the world. Dr. Mitchell, could you just, for me, in layman's terms, explain what Felipe died of?
Yeah, so Felipe, he had a bacterial infection that was superimposed on flu. So everybody knows what bacteria is when I say it. It's a small organism that can cause infection. This particular type of organism that he had flu, and then that flu had a bacterial infection on top of it. And it was the type of infection he had was so severe that it caused a rapid disease within his lungs. And so he died from like a hemorrhagic pneumonia or sepsis. And so that's functionally what he died from.
Dr. Danaher, let me ask you, and I think both you and Dr. Green mentioned the uniqueness of treating children and when the symptoms show. Does it require special training to determine how severely ill a child is?
Yes, I would say it does.
Ms. Gambler, in your written statement, it says that the report you're releasing today has found, and I quote, CBP does not provide officers and agents with training to identify medical distress in children. Is that correct?
Yes, that is our finding.
And to the Inspector General, in reviewing Felipe's death, did your office examine whether the agents who were responsible for caring for him had received training in identifying medical distress in children? If so, what did your office's review find?
You need to unmute yourself. Still not able to hear you. Looks like we'll.
Well,
I'm sorry, Mr. Chairman, my computer froze. I had to come back into the meeting. I'm very sorry.
let me repeat that question then. In reviewing Felipe's death, did your office examine whether the agents who were responsible for caring for him had received training in identifying medical distress in children? If so, what did your office's review find?
My understanding is the Border Patrol is trained in basic first aid, CPR, and trauma care. They also have advanced EM or paramedics in several of their stations. In this case, in the case of Jacqueline, there was a paramedic who happened to be at that station. I didn't find any evidence of pediatric training at all.
Well, it was also clear that Felipe's father asked for him to be returned to the hospital in a sense of urgency. It took about an hour before they left the station. So it's unclear if the urgent nature of the situation was conveyed to everyone involved in the transportation. So, Dr. Danaher, given those circumstances, are there any questions about CBP's policies and practices for dealing with emergencies that should be reviewed?
One issue that rose for me in reading the time frame in which Felipe received care was whether anybody is actually entering a cell to examine a child at the time that medical assistance is requested. From what I could tell from the records that were available, it appeared that we were checking on him through the cell door, but it's not clear that anybody took a close look at him. I believe that if they had, it would have been very, very apparent.
And to the Inspector General, if possible, could you either forward to us, articulate any recommendations or policy revisions you have after reviewing Felipe's death and the file surrounding it?
Sir, we have
With that, Mr. Chairman, I yield back.
You can answer the question.
Thank you, Mr. Chairman. Sir, as I mentioned, we have ongoing projects to look at that exact question, and we'll be very happy to provide the committee with our recommendations once we finish those reviews.
So you said that's the end of December, right?
We should have one sometime toward the end of this year for you, sir.
Thank you. Chair recognizes the young lady from Arizona, Ms. Lesko, for 5 minutes.
Thank you, Mr. Chairman, and thank you for those testifying. When I read the accounts of the two young children dying, I mean, it's very sad. I'm sure all of us can agree that it was sad and we wish it didn't happen. But if I heard it right, Dr. Mitchell said both deaths were preventable and blamed the Customs and Border Protection Agency. And Dr. Danaher said Customs and Border Protection Agency was at fault. And after reading the IG's report of what all happened, I really failed to see how you came to that conclusion. I mean, first of all, you had in the young woman's or the young girl's account, she entered the U.S. and was apprehended on December 6th after traveling, I assume, thousands of miles. The CBP asked if anyone was sick because they wanted to get the sick people on the first bus, and they didn't say anything. Then they didn't fill out on the form. They said actually on a filled out form that they were not sick, that they were healthy. And then the father didn't say anything to the CBP officers that his daughter had been vomiting. And he told the bus driver that his daughter was vomiting, but didn't tell CBP. So then they got off the bus first after they found out from the father, and the EMT gave immediate medical care. And it was only then that the father told the EMT that his daughter had been vomiting and not eating for 2 to 4 days. So I fail to see how that is the agency's fault. And then they airlifted her to a hospital, and unfortunately, she died. In the case of the boy, it sounds like the CBP transferred as soon as they knew there was something wrong. The hospital didn't write in their things that he had influenza B, didn't give medication, the amoxicillin, didn't note that. So to me, that seems more like a hospital error than CBP error. And so my question to Mr. Kafari is Mr. Kafari, in your investigation, have you determined that either one of these parents, the parents seek medical care and the child received medical care before they were apprehended by CBP, especially the girl who had been sick for 2 to 4 days?
It doesn't sound as though that the investigation found that that had been the case. Their first medical treatment was once they became into CBP custody in 2 different instances, one at the Lordsburg station and the other at the facility at the checkpoint.
And thank you. And Mr. Kafari, do you think the cartel would have given them medical care? I mean, the accounts I've heard about the cartel, they could care less about these people. They just make money off of them.
Representative Lesko, it's beyond the scope of my testimony here today.
Well, you know, it's my opinion that instead of blaming Customs and Border Protection Agency for everything that happens, to me, it was clear that traveling thousands of miles, we should start blaming the cartels, don't you think? And people, they should at least be partly accountable for children's death. If the parents don't tell the medical people or Customs and Border Protection that their child's even sick, they've been traveling thousands of miles. I mean, I just think it's unrealistic and to expect the Customs and Border Protection to just know that these things are going to happen. To me, it seemed like they went over and beyond trying to help these children. And I have a few seconds left to give to Dr. Green.
Chair recognizes the gentleman from Tennessee for the balance of the time.
Thank you, Mr. Chairman. Very quick question to Dr. Danaher. Have you done med mal cases, review cases before?
No.
You obviously reviewed the records here. What stood out to you about the resuscitation in this case of Felipe's resuscitation when you reviewed that case?
In terms of when he presented to the hospital the second time?
The second visit, when they tried to resuscitate him, was there anything that jumped out to you as a physician on that resuscitation documentation?
I mean, there were definitely some irregularities in terms of what happened when he reached the hospital. But he arrived already pulseless. They had a really difficult time intubating him. There was a significant amount of blood in the airway, so they had multiple failed intubation attempts, including an esophageal intubation.
If I could just say, answer the question, because I know you've played, guess what I'm trying to ask you before as a physician. We do that a lot to one another. But he was incorrectly intubated, and they continued the resuscitation for several minutes with the breathing tube down his esophagus. Clearly, that you can't resuscitate a patient, and he's not getting oxygen for several minutes in the resuscitation. That's problematic for saving the child's life. I yield.
Chair now recognizes the gentleman from New Jersey for 5 minutes, Mr. Payne.
Thank you, Mr. Chairman. I appreciate the opportunity to be here today. And it is very interesting to listen to the gentleman from Tennessee's who has stated that he has been on the defense side and the prosecution side of these issues. Also, one of my other colleagues mentions that, it's the cartel's fault. We're all responsible. We're the legislative body of the United States government. We're responsible for making sure that nothing happens to these children. Because you see, the administration went down a road to collect these people and lock them up in cages. And then when something happens, oh, well, we didn't have anything to do with it. No, this is abominable. This is absolutely abominable what I'm listening to. 2 children have died. I put my children in that position. All of us need to put our children in a position. And I think there might be a different tenor to this hearing. But I only have 5 minutes, so Dr. Mitchell, can you please explain how and why video footage is important to understanding all of the circumstances surrounding a death in custody?
So I was one of the primary authors on the death in custody and how to report, examine, investigate, and report out deaths in custody put out by the National Association of Medical Examiners. And part of what that organization calls for is indeed any information that's available for deaths in custody, which includes any video footage, any medical records, anything that can give an idea of the time leading up to the death is going to be important to categorizing the final findings at autopsy.
Thank you. Inspector General, can you discuss the video footage you obtained and reviewed regarding Felipe's death?
My understanding, sir, is the video footage was obtained regarding while Felipe was in custody. Our trained criminal investigators reviewed that footage, and they determined that the footage married the testimony of the Border Patrol agents.
Okay, is there footage of Felipe leaving the station to travel to the hospital on that evening on which he died?
Sir, I'm going to have to get back to you on that specific question.
Okay. Did you review any aspect of the CBP's collection and retention of the video footage of the individuals in custody as part of the review of Felipe or Jaglin's death?
I'm not sure I understand the question, sir. We did obtain the video footage concerning the time period in which they was in custody, but to my knowledge, that was it. I don't believe we took any other footage outside of that time frame.
Okay, so you didn't review the aspects of how it was collected and retained, right?
The collection and retention would have been done by our criminal investigators or by CBP OPR agents acting on our behalf. The evidence.
So there would be in the report some mention of that, correct?
To my knowledge, yes, sir.
Mr. Chairman, how much time do I have? I know I'm getting close.
The gentleman has 1 minute left.
Thank you, sir. Inspector General, how many times did Border Patrol officers conduct wellness checks of Felipe on the day he died after he returned from the hospital? The first time and before he left the station for the hospital for the second time. How many times was he checked on?
The exact number I couldn't give you, sir, but from the report of the interview of Felipe's father and consistent with Border Patrol testimony, the father said that the Border Patrol agents checked on he and his son every 5 to 6 minutes while they were back in the facility after their first visit to the hospital and before their departure on the second time.
Okay, thank you. Mr. Chairman, I'll yield back. Thank you, sir.
Thank you, gentleman. Yields back. Chair recognizes the gentleman from Louisiana for 5 minutes, Mr. Higgins.
Mr. Chairman, Mr. Higgins is gone.
Okay. Okay, thank you. Chair recognizes the gentleman from Tennessee again for 5 minutes.
Thank you, Mr. Chairman. And I just want to say, we are responsible. I can tell you, I will never forget the first child that I had to pronounce. The child had been hit by a car, and the image of that mother bringing that child in her arms is forever burned in my brain. The loss of these two children, it is tragic, but what we're doing here is a forensic examination of the record to find where fault happened. This is designed to find where there is fault. And so it takes an objective, setting that aside and looking at the case. And so I want to ask Dr. Danaher again, the records are pretty clear that the father of young Jacqueline was asking for medications from his fellow travelers before entering into the United States. In fact, since the antibiotic he had on his hands was Flagyl, not the best for strep infection, they probably didn't get that prescribed by a physician. He knew she was sick and he failed to disclose it. You mentioned in your written testimony about the environment of a person answering questions to law enforcement being a barrier for Jacqueline's father telling the truth about his daughter being sick. And I want to ask you, are you suggesting that there's some kind of new standard of care that if a patient lies about their medical condition, the physician or that provider is somehow liable?
Not at all. What I'm saying is that the initial screening that occurred when this large group of migrants arrived at the forward operating base was, from what I can gather, one agent yelling to more than 100 people that if anybody was sick, they should come forward. They yelled this in Spanish. The father's native language is Quechua. And so we don't know if he heard them. We don't know if he understood them. On top of that, we're asking people to come forward in front of a large group of people to talk about their medical issues, which, as I'm sure you appreciate, can be very sensitive for some.
But you have children yourself?
I do.
So can you imagine having a sick child and not wanting them to know about it? I mean, I don't understand that dynamic.
I'm not sure.
Parents, I've taken care of a lot of pediatric patients in the ER, and those parents are afraid. They come in and they want to tell you, and why would he? I don't understand why a father who cares about a child would specifically lie when asked. And they asked in Spanish, and he responded in Spanish, so he clearly understood Spanish.
So I think that there is a difference between being able to speak a little bit of Spanish versus to share sensitive or nuanced medical information in Spanish. On top of that, the questions on the health interview form are very non-specific. There's one question about any type of illness, and the rest are about things that wouldn't be particularly relevant to Jacqueline's case. So this all hinges on whether the father understood that one question.
I don't agree. I don't disagree with you that a form review could make that form better. I can't make CBP responsible for a guy who says his children are okay when asked if they're medically ill. Let's flip to Felipe's case, and I only have a little bit of time, so I'm going to get right to it. You made some very, I think, appropriate comments in your written testimony about his first visit. When he went in, and I mean, it was horrible when I looked at it, but I want you to tell the committee what you thought about his care when he was first brought to the hospital there at GCRMC, and whether you think they should have let that patient go home.
No, they absolutely should not have let him go home. And I agree with you that the care that he received was very concerning during his first presentation. His vital signs were significantly abnormal. His heart rate was persistently elevated even when he did not have a fever. His oxygen level went as low as 91% at one point. It's not clear that anybody noted that fact. The physician who saw him later acknowledged during a CMS review that he had not reassessed Felipe before the child left the facility.
Yeah, and I didn't see any assessments for hydration status, tears or voice mucous membranes. I mean, all those things would be standard of care. This is an American physician in an American emergency department, and they let this kid go home. my question is, would a normal law enforcement officer question a physician like that? Is he trained enough to question the physician?
Well, what's interesting in this case is that it appears that the law enforcement officer did. He actually advocated for Felipe to receive more care before they left, and continued to express concern after they left, which says to me that they could recognize that he was quite sick.
Yeah, they definitely recognized that the care given was pretty shoddy. I mean, I think he had to ask to have the temperature taken. So thank you. I yield, Mr. Chairman.
Thank you very much. Chair recognizes the young lady from New York for 5 minutes, Ms. Rice.
Thank you, Mr. Chairman. And I would just first like to thank the Inspector General for being here today. I only wish that you had been available when we did a hearing on these two terrible deaths back in January, and you would not come to that hearing. So I'm glad that you are here today. I think would it be fair to say, Mr. Inspector General, that in the course of reviewing Felipe's death, you clearly don't come to a conclusion that the CBP did anything negligent or inappropriate? Would that be correct?
That's correct, Ms. Rice.
So, would you say it's fair to say that the Border Patrol agents were not properly trained to be able to comply with the TEDS standards for responding to a medical emergency involving a detainee with difficulty breathing, would you say?
I would say that based on the training that the Border Patrol was provided and had at the time, that they complied with the standards upon which they were being judged.
So let me just read specifically from the TEDS standards addressing medical emergencies. It states, and I quote, "Emergency medical services will be called immediately in the event of a medical emergency, for example, heart attack, difficulty breathing, and the call will be documented in the appropriate electronic system of record. Officers, agents must notify the shift supervisor of all medical emergencies as soon as possible after contacting emergency services." Now, according to your review of Felipe's death, at approximately 5 p.m. on the day he died, Felipe was observed to be having difficulty breathing and complained about pain in his stomach. An agent reported that he asked Felipe and his father if they wanted to go to the hospital, and both declined. Do you think that that was appropriate behavior?
At the time, it appeared to be appropriate, was within a scope of our investigation, and that's what we determined.
So what do you mean at the time? Do you have any information now that would lead you to come to any different conclusion?
Ma'am, that's why we're doing the additional reviews and evaluations that I briefly mentioned at the beginning. We're going to be looking at those issues.
Dr. Danaher and Dr. Mitchell, are there issues of informed consent that could come into play in situations in which CBP personnel are asking parents and children in detention if they want to go to the hospital, particularly if they have already been to the hospital on that same day?
Dr. Mitchell, would you like me to respond first?
Sure.
Yes, so I think that there are multiple issues here. One is that once a child is in custody, the parent is not really in a position to be advocating for their child to go back to the hospital. The child is in the custody of the government. On top of that, we have to remember that when immigrants are in detention, they may perceive themselves as being at the whims of the Border Patrol agents, and they may not want to make themselves a nuisance because we have to remember 6 months prior to this, Border Patrol was separating parents from their children. And there's real reason for people to be afraid of what might happen if they displease an agent. So I'm not suggesting that agents did anything to intimidate the family at all. I'm just saying that the dynamic of being in detention makes it very challenging for parents to advocate for medical care for their children.
So let me just also say, I think that everyone at this hearing would agree that there were mistakes that were made at the hospital. Clearly, he never should have been and released that first time. There's no question. And I don't know if there is an investigation into the treatment, the medical treatment he got at that hospital or not, but there should be for sure. But any attempt to blame the parent in this situation, Felipe, when he came into custody, was a perfectly healthy child. He got sick while he was in custody. So CBP had it within their discretion to actually not keep Felipe and his father in custody for those 6 days between the time that they were apprehended and when he died. They could have paroled him. That was well within the discretion of authorities, the government at that time. And let me just also say that, I was happy to hear Dr. Green talk about how important it is to invest in our healthcare system. If no better time than now for us to discuss this, especially as we're dealing with the pandemic, and we are seeing the disparate way that our healthcare system works for people of color and people in certain socioeconomic backgrounds. So I'm glad to hear Dr. Green talk about how important it is to invest in this. But I think we all have to agree that children present at the border, and our primary responsibility to them is to keep them healthy and not have them die in our custody. And so we have to make the system work better. I am not blaming these CBP officers because they're not medically trained personnel, but then that means that we need to have medically trained personnel at the border. And my colleague, Ms. Underwood, given her background and her repeated trips to the border before this whole pandemic happened, was calling for just that, a more comprehensive health check for every single child who comes into the custody of CBP or ICE. So I just want to thank all the witnesses for coming today, and I yield back, Mr. Chairman. Thank you.
Thank you very much. Chair recognizes the gentleman from Texas, Mr. Crenshaw.
Thank you, Mr. Chairman. Thank you for holding this hearing. My first question is for Ms. Gambler from the GAO. I just want to clarify something, because the line items on medical care you mentioned, those are from the emergency supplemental, correct?
Yes, sir.
And that all occurred after the deaths in question, correct?
The emergency supplemental was enacted last summer, July 2019.
Right, but the spending occurred.
The spending occurred then after enactment. So, right. Yes, sir.
This is not in the same time frame. So I just want to highlight for the record the GAO's findings that don't have a cause-effect relationship with child custody deaths in question. Mr. Kufari, and just to confirm, there are 2 completed IG investigations, 1 continuing ongoing, correct?
Concerning deaths in custody, sir?
Yes.
Yes, that's correct.
And of the 2 completed investigations, the IG determined that all CBP employees who were involved did everything possible to ensure both children received medical treatment and there was no misconduct or malfeasance, correct?
That's correct, sir.
And from your testimony, it sounds like the main issue here is overcrowding, correct?
It was an issue, actually, that we raised during our unannounced site inspections of CBP facilities in 2019. We issued what's called a major management alert to DHS headquarters, right. And they implemented procedures to alleviate the overcrowding. I'm told that right. They would complete that by the end of this year.
No, thank you. I mean, and it raises the issue we've long raised, which is the reason there's overcrowding is many of our policies encourage people to illegally cross the border. There's multiple factors at hand. And the reason I bring all this up, it raises the question of the purpose of the hearing. If there's any evidence of malicious intent by CBP, I think this hearing would certainly be warranted, but there is not. This hearing appears to be designed to, at worst, to drive a false narrative that implies malicious behavior by CBP. At best, we're seeking to falsely imply that these tragic deaths could have been prevented by better action by CBP officers, even though the children's parents brought them across our border in extremely poor health. Furthermore, these false narratives, they lack context, falsely assuming that the purpose of border stations is to provide hospital-level childcare. Of course, the truth is the purpose of CBP is in fact customs and border protection. When I went to the Rio Grande Valley sector late last year, there was a humanitarian crisis unfolding. In January 2019, there were more than 58,000 apprehensions. In February, that climbed to more than 76,000. Total border numbers spiked to 144,000 in May. Let's also keep in mind these were not typical single male economic migrants. They were mainly family units, more than 473,000 in FY 2019, and unaccompanied minors, more than 76,000 in 2019. These migrants are handled differently and completely overwhelmed our Border Patrol processing centers. While this crisis unfolded in early 2019, we were sounding the alarm. It was ignored. The crisis was, quote unquote, manufactured. We didn't vote on an emergency supplemental appropriation until late June. By that time, there had been more than 750,000 apprehensions or inadmissibilities along the southwest border. So again, why are we holding this now? And I have to wonder, is it because demonizing law enforcement is popular right now? Our Border Patrol agents haven't been targeted enough lately? Let's be clear, each of those children who lost their life is absolutely tragic. It is also shameful to try and put the blame on our CBP officers and Border Patrol agents. And I think we could engage in some intellectual honesty and highlight the fact that in the past 18 months, almost 475,000 agent hours have been spent transporting migrants to hospitals and staying on hospital watch with sick migrants. As we know, those who make the trek from the Northern Triangle do not make it here in the best condition. We could highlight the fact that more than 8,000 migrants in distress, whether rescued from the Rio Grande River or found in need of medical need due to dehydration, injury, or pregnancy complications, have been rescued by Border Patrol. Approximately 200 of those were directly attributed to CBP Air and Marine Operations Assistance. We could also mention the Border Patrol Search, Trauma, and Rescue Teams, which was created in 1998 to respond to injured Border Patrol agents in remote locations, but now their main mission is actually rescuing migrants in distress. We could discuss the number of children and women saved from human trafficking by CBP. We could talk about CBP being on the front line of keeping drugs and other contraband out of our country. Fortunately, though, positions and priorities appear clear. So while we hold this hearing, I want to take the opportunity to let our CBP officers and Border Patrol agents know that we appreciate your service. We appreciate what you're doing under the most difficult of circumstances. We do have your back. Thank you, and I yield back. Thank you, Mr. Chairman.
Chair recognizes the gentlelady from Michigan, Ms. Slotkin, for 5 minutes.
Thanks very much, Chairman. So I'd like to pivot to talk about something that actually Mr. Crenshaw raised, which was the special appropriation, the emergency appropriation that we passed last summer. And you know, in particular, I'm interested in the $112 million that we appropriated to provide for detained medical care and necessities. So we passed this $4.5 billion supplemental. I voted for it. I think many folks sitting here watching voted for it. And I wrote to the acting secretary about this just to make sure we understood how that $112 million was being spent. We got a response back about 8 months later from CBP just in March. So Ms. Gambler, can you help us understand and elaborate on GAO's findings regarding CBP's use of these $112 million specifically, please?
Certainly, Congresswoman. We found through our legal decision and audit work that CBP did obligate funds from the consumables and medical care line item for some goods and services that fell within the definition or the meaning of consumables and medical care. So that included things like hygiene products, clothing, gloves, masks. But we also found that CBP obligated funds from that line item for goods and services that did not fall within the definition or the meaning of that line item, the primary purpose of that line item. And that included things like goods and services for CBP's K-9 program, computer network upgrades, facility services and upgrades. And we concluded that CBP violated the purpose statute under appropriations law, and we concluded that CBP should make adjustments to its accounts accordingly.
How much do you believe of the $112 million was misspent on things that were not intended?
At the time of our work for the legal decision, Congresswoman, CBP had not completed its review of the obligations it made under that line item. After we provided a copy of our draft report to CBP, they reported to us that they completed that review, and they identified $13 million that they plan to adjust among accounts from last year's emergency supplemental, and at least $3.9 million that they plan to move from the consumables and medical care line item to CBP's regular appropriations. I would just note that given the timeframes for our review, we have not reviewed that information that CBP reported.
Okay, I mean, I guess I would hope that everyone on the committee cares about how the money that Congress appropriates is spent, and that was certainly concerning. Mr. Kurfari, can you give us your assessment of this $112 million? Are you formally doing an IG review of the expenditure on this money?
Yes, Madam Congresswoman. We have a open audit that's going to look at the CBP's use of FY 2019 appropriation funds for humanitarian assistance. We're going to check with our colleagues and cousins at GAO and make sure that we get all information that's available. And
what's the timeline of your review? When do you expect to be complete?
We just opened that a few weeks ago, ma'am.
So, couple months?
I can't give you a definitive timeline, but we're going to do as quickly as possible.
Okay, I just think it's important, and I would love to hear your commitment to come back and talk to us about that. It's just one of those things, it's like our primary responsibility as an oversight committee to make sure we know how that money's spent. And I literally have no sort of piece of this, special knowledge of it. I just think we all are saying from various angles that we want, this issue to be resourced well to the best of our ability to support CBP so that they can do what they need to do on detainee health. So can you commit, Mr. Kurfari, to coming back and testifying in front of us about this issue?
You have my continued commitment to be responsive to the committee.
Great. Thanks so much. I yield back. Thank you, Chairman.
Thank you very much. Chair recognizes gentleman from Pennsylvania, Mr. Joyce, for 5 minutes.
I want to thank all the witnesses for appearing today, and I want to thank you, Mr. Chairman, for making the committee room available for this hearing today. I would like to yield my time today to my distinguished colleague from Tennessee, Dr. Mark Green.
Chair recognizes the gentleman from Tennessee for the balance of the time.
Thank you, Mr. Chairman. I want to first thank Congresswoman Slotkin for her questioning. I thought I echo everything she said and agree with her 100%, and look forward to hearing back from the department on those misfit funds. That really is one of our primary concerns. I also want to appreciate the fact that Congresswoman Rice recognized and reiterated the need for America to address this physician shortage. We have significant physician shortages now, and it's only going to get worse in the coming years. My point in bringing it all up is that we had testimony from witnesses who said we needed licensed professionals. My conclusion from all this is we can't take those people where Americans aren't even getting care and put them on the border. What we really need to do is give advanced training to our CBP personnel and make sure they're better trained to do those kinds of assessments, because I just don't think it's feasible to put licensed medical personnel down there. I also want to say that I agree with Dr. Danaher that the pediatric cuff, the pulse ox would have been helpful at those border facilities, but as an emergency physician, I can tell you that when Jacqueline was posturing, it would not have made a difference in this case, and to say so is a little bit misleading. Also, as a doctor, I've provided care from Zawai, Ethiopia to the Himalayan, and a good field medic doesn't need a BP cuff to get a decent pressure off of where you take the pulses. Dr. Mitchell, I wanted to ask you, what areas of the hospital, what areas of hospital care and care of a patient do you recognize as the highest risk for medical errors?
Well, in my experience, I've seen medical errors in the surgical suite. I've seen medical errors in the ICU. I've seen medical errors upon presentation. We talked about the poor intubation of one of our patients. So, you know, where medications are prescribed and infused, you can see medical errors. So there's several places within the system where you can see them.
Well, JACO has done some pretty extensive research in this. Obviously, the Joint Commission on Hospital Organizations, they're the folks that accredit our hospitals for those who aren't medical providers in the room. They've done a lot of research on this, and those transitions of care are fraught with risk. When one provider hands a patient off to another provider, going from the emergency department to the ICU, shift change is an incredibly high risk time. And the gentleman from Louisiana mentioned that pickup time when one of the officers was going off shift with Felipe particularly, and another came on, gassed his car up, got there a few minutes late. But when he got there, if you'll recall from the testimony, tell us what that officer did and how he responded when he discovered the severity of the situation with Felipe.
Well, I think the Border Patrol agents acted swiftly to engage the patient and try to get the patient to care, and that was evident throughout the record that I reviewed.
Do you think there was anything else they could have done?
No, I think the agents are acting, you know, particularly in Felipe's case and quite frankly in Jacqueline's case, these agents, when they became aware, they moved to make sure that those individual patients got to care. And so, you know, they, I don't think probably are as equipped to recognize the things that they needed to recognize. And so we talk about that training, we talk about making sure that we have adequate personnel that is doing that work and not putting it on agents whose job it is to protect in a different way the border. But yeah, I think the actions were swift and accurate.
Thank you, Mr. Chairman. I think my time is up.
Thank you very much. Chair recognizes the gentleman from California, Mr. Correa.
Thank you, Mr. Chairman, for holding this most important hearing. Can you hear me?
Yes, sir.
Yeah, and I want to thank the witnesses as well. I'd like to direct my questions to Dr. Danaher and Dr. Mitchell. The topic, CBP directives on medical care for our children. In January 2019, following the deaths of 2 children in CBP custody of December 2018, CBP expanded the use of contract medical personnel. It's a good step forward. CBP also issued a directive setting forth interim enhanced medical efforts to mitigate risks to and improve care for individuals in CBP custody along the southwest border. The interim directive required the Border Patrol to conduct a health review and medical assessment of all migrants under the age of 18. December of 2019, CBP issued a final medical directive, and that final directive appears to be weaker than the interim directive. For example, it only required medical assessment of children under 12 rather than children under 18. And Dr. Danaher, if I may ask you a question, have you had a chance to review the interim and final medical directives?
Yes, I have.
Do you see other deficiencies in the final medical directive?
Yes, there are actually a number of issues that I find quite concerning.
Please elaborate.
Sure. One is the time frame. The initial directive, as I recall, explicitly stated that these health interviews should occur upon initial processing, whereas the final directive does not state when the health interview needs to occur. It also narrows the scope of what is considered a basic medical screening so that it no longer specifies that vital signs must be collected. And as we've already discussed in Felipe's case, vital signs could have made all the difference if somebody had been paying attention. As you mentioned, it only mandates medical screenings for children under 12 or those with identified medical issues, and it includes a caveat. This is subject to availability of resources and operational requirements. We have to remember that 2 of the children who died in the time frame that we are discussing were 16. And so it's unclear to me why we're reducing this cutoff to the age of 12. It also seems to reduce the qualifications required for performing medical screenings, saying that they'll be conducted by healthcare providers where available. And it does say that basic acute medical care referral and follow-up can occur on site, which on the surface is good. We want there to be medical services on site, but we want to make sure that that does not mean children won't have access to pediatricians when they need them.
Earlier this year, the American Academy of Pediatrics submitted a statement for the record to this committee, which had stated that the final directive, and I quote, open quote, is wholly inadequate to ensure the proper care of children in custody and represents a step in the wrong direction as compared to the interim medical directive. Dr. Danaher, would you agree with that assessment?
Yes, I do.
And what changes should be made to the directive, the final directive, to ensure that the adequate medical assessments are conducted on all children?
So as these cases that we're discussing illustrate, it's extremely important for health interviews to occur in a timely fashion upon apprehension, and they need to be performed by somebody who has at least some basic medical training. That could be an EMT. It does not have to mean moving physicians to the border for this purpose. We also need to make sure that these health interviews ask directed questions so that patients understand what they're being asked about. And we need to make sure that medical screening is offered across the board. We don't want to be missing children just because we're saying that the onus is on the parents to speak up when they notice something's wrong. Once these children are in custody, they are the responsibility of CBP, and we need to make sure that they're all healthy.
Thank you, Mr. Chairman. How much time do we have?
Gentleman has 40 seconds.
Dr. Mitchell, do you have anything else to add to this topic of the final medical directive and its deficiencies?
No, I think it illustrates that there's a need for a level of training and a level of expertise when dealing with these patients, particularly children under the age of 18. And I think that if we're talking about systems and developing better access to systems, then we would put those resources in place to ensure that our children are being initially screened by individuals that have the proper level of training to ensure that we have better outcomes.
Thank you very much. And Mr. Chair, time being over, I yield. Thank you very much.
Thank you very much. Chair recognizes the gentlelady from New Mexico, Ms. Tara Small, for 5 minutes.
Thank you, Mr. Chair. Thank you for holding this important hearing, and I'm glad that we're all here to reckon with these challenges together, because it's crucial that we make sure that people in our custody are safe. And I want to begin by offering my condolences to the families of Jacqueline Calmaquin and Felipe Gomez Alonso and other migrant children who've died in U.S. custody. Since the deaths of Jacqueline and Felipe, both of which occurred in the district I serve, I've called on DHS and the Inspector General numerous times to comprehensively investigate what happened, and specifically what holes in DHS policy need to be filled to make sure we aren't putting our Border Patrol agents in situations where they don't have what they need to keep kids safe in their custody and to stop more migrant deaths from dying in our custody. This shouldn't be a blame game. This should be looking forward into the future about how we can solve this together. I also want to note that these children's deaths occurred in the district I serve, and I agree that we must also take action to expand healthcare for rural Americans. I invite all of my colleagues to co-sponsor the Resident Physician Shortage Reduction Act, legislation Mr. Katko and I have championed to train and keep more rural healthcare providers. As well, the Training the Next Generation of Primary Care Doctors Act, the Conrad State 30 and Physician Access Reauthorization Act, the Keep Physicians Serving Patients Act, the Maternal Health Quality Improvement Act, the Promoting Access to Diabetic Shoes Act, the Nurse Act, the National Nurse Act, the Immediate Relief for Rural Families, Rural Facilities and Providers Act, Act, the Healthcare Workforce Resilience Act, the Medicare Accelerated and Advanced Payments and Improvements Act, the Save Our Rural Healthcare Providers Act, the Border Health Security Act, and the Rural Maternal and Obstetric Modernization of Services Act, all of legislation I have co-sponsored or sponsored to help improve healthcare for rural Americans. Inspector General, in your testimony, you noted several new issues of which your office is working on. In your testimony to Mr. Crenshaw, you stated you have one ongoing investigation of a death in CBP custody. Is your office reviewing any other deaths in CBP custody?
So very good to see you again, ma'am. Thank you for the question. I believe that is the only additional death in custody investigation that we currently have.
Thank you, sir. I appreciate it. In your testimony today, you also noted to Ms. Rice that you did not have a single medical professional on your staff during the investigations into Jacqueline and Felipe's death. Will your ongoing investigation into the other death be conducted in the same manner, or will any changes be made in how you review that death?
Based on the increased funding, as I mentioned, that the House and Senate gave us this year, we were able to seek outside medical contracts. I'm happy to report that within a few weeks, that contract should be awarded, and I anticipate probably by the end of next month, those individuals, healthcare providers, will be able to augment our inspectors, investigators, and our auditors.
Thank you. And how specifically will the ongoing investigation and the use of medical personnel differ from the investigations into Jacqueline and Felipe's deaths?
They won't at this moment because the investigation is at the very end of its cycle.
So you will not supplement that investigation with medical information and expertise?
No, we will do a supplemental review of scoping of the entire Border Patrol's handling of medical healthcare providers and services to in-custody children.
In the last minute, in your testimony, you indicated your office is working on a review of, and I quote, CBP's use of FY 2019 appropriated funds for humanitarian assistance. What exactly will you be reviewing in that work, and will you be looking more closely at the misspending that GAO has already identified and that Congresswoman Slotkin discussed in her questions?
Certainly. But then let me just clarify my last response. In this particular case, we have engaged the services of an outside medical examiner in the very last instance. So we will have someone from outside looking at the medical review and the autopsy. So to your current question, what we're going to be doing is looking at the great work that the GAO has done. We're going to be expanding on that, looking at whether CBP is adequate plan for the deployment of the appropriated funds to quickly and effectively address the humanitarian needs of the border.
Thank you, and I yield the remainder of my time.
Yes, ma'am.
Thank you very much. Mr. Inspector General, how long have you had the money that you plan to obligate for contractual services for personnel? How long have you had this money in the budget?
I believe, sir, the appropriations came in January, and we were funded in February or March of this year.
So you've had the money about 6 months?
Yes, sir.
Thank you. Chair recognizes the gentlelady from Illinois, Ms. Underwood, for 5 minutes.
Well, thank you, Mr. Chairman. Let me be blunt. This administration's treatment of migrant children has been appalling. 3 years ago, the Department of Homeland Security implemented a policy of separating families at the border. As a nurse and public health expert, I'm familiar with the data showing that family separation causes trauma that can do both immediate and long-term damage to children's health. But it doesn't take a nursing degree to understand that. We all know it's inhumane, immoral, and just plain wrong. Today, we're trying to get to the bottom of deaths of just 2 of the migrant children who have died in federal custody under this administration. Felipe and Jacqueline are among the 6 children who died either during or shortly after their time in CBP detention on this administration's watch, after a decade with 0 deaths. Mr. Kafari, the timeline included in your office's report regarding Felipe's death states that during his first hospital visit on the morning of December 24th, 2018, he was diagnosed with influenza B. However, the written discharge instructions included with the medical records from his first hospital visit appear to have been for the treatment of, quote, an upper respiratory infection pediatric, without specifying an influenza diagnosis. Did your office conduct interviews with any of the medical personnel who provided care to Felipe?
No, ma'am, that was outside the scope of our investigation.
Did you conduct a forensic analysis of Felipe's medical records to fully understand what the Border Patrol agents were told about the influenza diagnosis and why?
We didn't conduct a forensic analysis. We conducted a review of the medical records that we obtained from the hospital and noted that in the discharge paper for Felipe, there was no indication on there that Felipe had tested positive for influenza B.
Dr. Danaher, in June, the Inspector General's office issued a report entitled CBP Struggled to Provide Adequate Detention Conditions During 2019 Migrant Surge. This report stated, quote, crowded conditions presented health challenges for on-site medical staff in some facilities, including containing the spread of contagious illnesses. Felipe had been in custody for 6 days when he died, which is 3 days longer than allowed. Do you believe it's possible that Felipe contracted influenza while in CBP custody?
I believe I can actually state with certainty that he did, because the longest incubation period for influenza is 4 days, meaning time from contracting the illness to manifesting symptoms.
Thank you. Ms. Gambler, last fall, I joined my colleagues in writing to the Centers for Disease Control and Prevention to request information about their recommendation that CBP should vaccinate all migrants over the age of 6 months at the earliest feasible time. I am certainly disappointed that nobody from CBP is here today to answer questions about why they have not implemented the CDC recommendation. Ms. Gambler, did your office examine CBP's decision to not implement the CDC's full recommendation? And if so, what did you find?
Yes, thank you for the question. Through our work, we did identify that CBP has not fully documented the reasons for its decision not to offer the influenza vaccine to those in its custody. CBP identified to us a number of challenges to offering those vaccines, including things like providing cold storage and the need for increased contracted medical care provider, but they didn't document how they considered or weighed those costs or considered those costs versus the benefits that could come from offering influenza vaccine. And so our recommendation was really geared toward CBP more fully documenting the reasons why they decided not to offer the vaccine,
right,
including how they consider costs and benefits, so that as they continue to have conversations about public health issues going forward, they can have a record and good documentation of the decisions they're making.
Thank you. Ms. Gambler, I understand from your written statement that CBP claimed that offering flu vaccines to people in their custody would, quote, provide little benefit to the agency because their goal is to transfer people out of their custody quickly. However, as we saw with Felipe's case, CBP doesn't always transfer people quickly. Isn't that right?
That is right. There are reports, and I think the Inspector General has reported this as well, that individuals can be in CBP's custody for longer than the amount of time that CBP is hoping to detain them for that short period of time.
Ultimately, from a medical standpoint, we know that there are consequences of CBP's failure to implement the CDC's recommendation on vaccination. And given the ongoing coronavirus pandemic, we know that individuals who might come into custody would be at increased risk as well. Thank you so much, Mr. Chairman. Thank you to our panel of witnesses, and I yield back.
Thank you very much. Chair now recognizes the gentleman from Missouri, Mr. Cleaver, for 5 minutes.
Thank you, Mr. Chairman. Mr. Inspector General, I don't want you to please take this as some kind of an insult, but in Washington, candor is sometimes silenced, leaving only power as the source of sound. I don't think there's any reason for anybody, for me to question any of your integrity. And please understand that's not just a statement I'm making. And I'm after another kind of an issue anyway. But my issue is that, do you feel comfortable? Am I still being heard? Right. Hello? Okay. My question.
Get your question. I'm sorry.
Yeah, my question is, do you, based on everything that you have seen and heard, I mean, we have a number of IGs who've been fired, relieved of duty. And so my question is, do you feel comfortable in being as candid as possible without fear that you would be silenced if you were to say something that was not in harmony with the power that is all around all of us?
I take your question, sir. I commit to you that if I ever felt any pressure to change my opinion for whatever reason, I would come to the chair and the ranking member of this committee and other oversight bodies, both in the House and in the Senate. As you know, I have more than 40 years of honorable service as a U.S. Air Force officer, and I served every president from Jimmy Carter to the current President Trump. Mm-hmm. And I stand committed to speaking truth to power, sir.
Well, and there's never been anything you've said or done that would cause me to believe otherwise. I'm just raising a question because of things that I'm saying has happened in Washington, things that have happened in Washington that at least appear to be unsavory. Now, so thank you. You are familiar with the fact that one of the agents who taking care of Felipe had to pay for some of the over-the-counter medication.
Yes, sir.
Out of his own pocket. Do you know? Can you explain what that might have? What might have precipitated the fact that someone would have to, go in their own pocket and pay for some medicine for a kid that obviously appeared to be sick?
It appeared that the prescription for amoxicillin at the hospital it issued was covered under their healthcare services, but the over-the-counter medication, which was for acetaminophen, I believe, or ibuprofen, perhaps, stand corrected, was not covered. It was an over-the-counter medicine.
Well, my assumption, Mr. IG, is that the agent. That we found out that the agent had actually used his or her own money because they were reimbursed. Is that how this came to our consciousness?
Actually, I don't know, sir, if he was reimbursed. He did pay for it up front. I don't know whether he asked for a reimbursement on the back end.
Yeah, I was just curious about how we found out about it, and perhaps he mentioned it to someone, which is not unusual for people who are committed and dedicated. My sister is a principal of an elementary school here in Kansas City, and I'm always, telling her she's going to retire broke because she's buying pencils and colors and all of that out of her paycheck. So that I just think that's something that the agent should be praised for, and he or she is probably not the only one.
I feel your pain, sir. My wife is a former high school principal as well.
Well, you're not going to have any retirement money because I've seen that all of my adult life with my sister. So, Dr. Danaher, do you have anything that you would recommend to us, to make corrections that this would not happen again? What would you recommend to us? Do we need to put some policies in place? Do we need to do anything that would assure us and the American people that this is not going to happen anymore, or we're certainly going to dramatically reduce the likelihood that it would happen again?
So I appreciate the question. I think it is extremely important, as I mentioned before, for healthcare screening to be occurring as soon as possible after we encounter children. And that needs to mean that we have people with at least basic medical training out in remote areas like the place where Jacqueline was apprehended. She had to wait several hours before she could receive medical attention, and that several hour period made a difference in life and death. So having people at the border who can at least recognize when children are sick and begin the process of getting into medical care quickly is extremely important. I think also having better protocols in place to screen and triage migrants when illness is identified, to make sure that they have access to appropriate medical care, preferably on site if possible, but it's very important that they also have access to pediatricians who may be on site. And of course, as Dr. Mitchell mentioned, we need to reduce overcrowding and all of the other conditions that are promoting infections at facilities.
Doctor, thank you very much. I really think that triage issue should be further developed. I wouldn't mind getting a memo on it. Thank you, Mr. Chairman. I yield back to balance my time.
Well, if you gave a staff, Mr. Cleaver, we'll gladly make that request.
Oh, thank you. I will do that. Thank you, sir.
Thank you. Chair recognizes the gentleman from Texas, Mr. Green, for 5 minutes.
Thank you, Mr. Chairman, and I thank the ranking member as well. Thank the witnesses for appearing. Let me start, if I may, with the IG. Sir, how many times did you visit the border pursuant to this investigation?
Sir, just so you know, set the record straight, I was confirmed by the full Senate at the very end of July of last year. Within 2 months, I went to the border to look at El Paso and the Tucson sectors. The investigations that the committee is holding a hearing regarded events that happened 7-8 months before even my confirmation. This would have been in December of 2018.
And while you were there, did you pursue any actions to further your insight into what happened to these children?
Not to the children's in particular, because these were events that had already occurred. I was looking at overarching conditions at the El Paso and the Tucson sectors.
You actually visited, I take it, the facilities where these children were detained?
Not these particular facilities, but except I stand corrected. We went to El Paso del Norte Port of Entry in El Paso, Texas. Yes.
And if you were at that port of entry, did you notice that it was somewhat akin to a large facility that allowed vehicles to flow through? Did you notice that, the place where the children were entered the facility?
I don't believe so, sir. No. Again, this is October of 2019.
I understand, but the facility is still the same, I assume.
They may have deconstructed whatever they had as temporary facilities.
No, there's a facility there that's probably still standing. This was what I would consider a main facility. But in any event, did you notice how the children were cared for immediately upon entering the country in terms of how they are housed and whether they are given blankets, whether they're kept warm? Did you notice any of this?
Yes, sir. I noticed that the El Paso Border Patrol station, where they had not soft-sided tents, but they had large structures that were constructed out of some material. The families were kept together in open bay sort of barracks. They had medical attention. They had hot meals. They had toys that were actually, in some cases, the Border Patrol agents were bringing them in for the children.
Do you think that the facilities are adequate for the time of year when it's cold and you don't have blankets? Do you think that this was adequate
From what I observed at the time on that particular day, that was about a 2-hour visit. They appeared to be adequate. However, I want to add, just emphasize that we are doing ongoing work to take a look at CBP's holding of detainees beyond the 72 hours and migrants experiencing serious medical conditions.
Well, isn't it true that they've upgraded since you were there, and they have better blankets and other materials for the children?
That's quite possible, sir, but I'm sure our inspections and evaluations will identify that in real time.
Well, let's move to the current circumstance. Do you believe now that we are prepared at the border to receive children who are sick and appropriately care for them?
I actually don't know. My intent is to have these 20 different audits and inspections answer that question.
Let's just talk for a moment. One of the physicians has been adequately questioned about his medical thoughts, and in a sense, somewhat challenged about his opinions. So let me just ask you a couple of questions. Is it true that there has been some question with reference to your PhD?
That is correct.
And is it true that you have signed documents indicating that you have a PhD, but not that it was in management, and some question about it being in management versus philosophy?
There was a posting on our official website when it came to our knowledge that there was a typographical error indicating that I had a PhD in philosophy, not a PhD in management, which is what I do have. We made the typographical correction. I also noted, I will add, that there were 1 or 2 commas that we recently noticed that we needed to correct as well.
Did you ever visit the university where you received your PhD?
I did on 2 occasions, sir.
And is it true that there's currently a Subway and a 7-Eleven store in that facility?
I have no idea. I attended the university from 1998 through 2002 when I was awarded my degree.
And is it true that there's some concern as to whether or not this was a meal process for presenting PhDs?
To my knowledge, I did all the appropriate work. I paid for the schooling out of my money. I worked for the Department of Justice Inspector General at the time. I did this through online learning, and I was awarded the degree that I earned.
Mm-hmm. I'm going to yield back, Mr. Chairman. Thank you.
Chair, the gentleman yields back. Chair recognizes the gentlelady from Nevada, Ms. Titus, for 5 minutes.
Thank you, Mr. Chairman. I'd like to go back to that capping report that was mentioned earlier that was issued last month by the Inspector General's office. That report summarizes the results of the office's unannounced inspections at 14 Border Patrol stations and 7 points of entry between April and June of 2019. Is that right, Mr. Inspector General?
That is correct, ma'am.
And as part of these inspections, you reviewed the migrants' access to medical care. However, the capping report states, and I quote, "Because our office does not have medical expertise, we did not evaluate